Grippostad C is a medicine for simple colds. It contains paracetamol, ascorbic acid, caffeine, and chlorphenamine maleate as active ingredients. Paracetamol relieves pain and reduces fever. Chlorphenamine maleate belongs to the group of antihistamines, supports the decongestion of the nasal mucosa and the reduction of mucus production, and this promotes unhindered nasal breathing. Caffeine has a mild stimulating effect and enhances the analgesic effect of paracetamol. It thus enables a reduction of the paracetamol dose, which means that the body is loaded with small amounts of painkillers. Vitamin C ascorbic acid supports the immune system and increases the body's defenses. Indications: symptomatic relief of colds and influenza, including fever, aches and pains, sore throat, and nasal congestion. How to use: oral use. Grippostad C capsules should be used during daytime only, as it contains caffeine which may cause insomnia. Duration of use: Grippostad C capsules should not be taken for more than 3 days without medical advice. This product should not be administered for a longer period of time or in high doses without consulting a physician. Recommended dose and dosage schedule: adults, including older people, 2 capsules up to 4 times a day is required. Maximum dose should not exceed 8 capsules in 24 hours, with at least 4 hours between doses. Pediatric populations: children 12 to 18 years of age, 2 capsules up to 3 times a day as required. Maximum dose should not exceed 6 capsules in 24 hours, with at least 4 hours between doses. Grippostad C capsules should not be used in children under 12 years. Contraindications: hypersensitivity to the active substances or to any of the excipients, pheochromocytoma, hepatic disease, severe renal impairment, hypertension, hyperthyroidism, diabetes, heart disease, narrow-angle glaucoma, concomitant use with tricyclic antidepressant or beta-blocking drugs or monoamine oxidase inhibitors within the last 2 weeks. Special warnings and precautions for use: this product should not be used by patients taking other sympathomimetics such as decongestants, appetite suppressants, and psychostimulants. Excessive intake of caffeine, e.g. coffee, tea, and some canned drinks should be avoided while taking this product. Caution is advised in patients with chronic excessive alcohol intake. An increase of the recommended paracetamol dose can lead to severe and potential fatal liver damage. To avoid the risk of overdosage, not other paracetamol-containing medicine should be used concomitantly. Side effects: Grippostad C can cause side effects, including decreased platelets, white blood cells, neutrophils, granulocytes, angioedema, rash. Toxic on kidneys is used for a long time. Belching, nausea and vomiting. Dose: insomnia, delirium, stress, dry mouth. These side effects are quite complicated. Notify doctor immediately to be treated if they appear.